Veterinary assisting course, we're going to look at Objective 7.01. We're going to discuss techniques to prepare and monitor patients during surgical procedures. Some of the essential questions that you need to answer before being able to move forward out of this objective are listed in the course material. To begin today, let's look at the surgical logbook. This is where we keep notes and information on all aspects of the surgery. Pre-surgical notes, notes that are taken during the procedure itself, and even preoperative or how the animal's progressing after the procedure is concluded. We keep these to meet legal and state regulations that may be in place. Let's look at the anesthesia logbook. That's the part of the process where we take information on the anesthesia itself, the anesthesia being what is keeping the patient under during the process. We'll be looking in the logbook to put information on how the animal's being put under, the maintenance during the anesthesia, and the recovery once the procedure is being wrapped up. And the anesthesia logbook is going to keep information about the temperature, pulse, respiration, blood pressure. Typically, those are taken every 5 minutes. The amount of fluid that's being received, any pain medication, and oxygen flow rate. In the preparation for the surgery itself, pre-anesthetic patient care, we'll look at the blood work. That's to help us to determine the proper anesthetic that may be required in the situation. What's the physical ability and limitations of the animal for the surgery? It would be in the physical examination. Pre-anesthetic patient care, it's very important to keep the patient fasting, no eating or drinking. For the veterinary assistant or veterinary technician, this is important information that has to be communicated with the owner so that this process is not conveniently overlooked and that they understand the importance of doing the fasting to help prevent any post-surgical complications. In addition, in pre-anesthetic patient care, there may be the need for administering a sedative to calm the animal depending on the situation at hand. In the surgery preparation prior to the procedure, a couple of important things that need to take place. It's very helpful if the animal empties its bladder prior to the procedure. May simply need to take the dog out for a walk to help make sure that it urinates. The surgery area in the preparation is clipped and prepared with a surgical scrub to be cleaned thoroughly. A lot of times this will be done by an assistant or a technician to make sure that we prevent any complications with infection. The animal is then placed on the table and secured in surgery preparation, and monitors applied that might be used during the process to keep tabs on temperature, pulse rate, oxygen saturation, and so forth. In looking at the situation here, a local veterinary clinic and a tech is preparing a Great Dane. Great Dane's name's Aaron Rogers. Aaron's coming in for surgery to have the lining of his stomach attached to the abdominal cavity to prevent the twisting of the stomach, which results in pretty poor outcome for the animal. Tends to be a common thing with Great Danes, and this is a preventative type surgery to help Aaron live an extended, long, and happy, healthy life. You can see here the technician's preparing for the surgical scrub. Aaron's already been placed and restrained on the table. In the bottom left-hand part of the screen, you can see the animal's been restrained to the table and is already under anesthesia. Typically, during surgery, fluid therapy is administered. IV catheter placement is done in the pre-anesthetic preparation. This allows for the administration of any pain medication. It's going to prevent dehydration in the animal with the fluid therapy, and it's also going to give a line where quick access can take place if there's an emergency administration of medications necessary during the process. Fluid therapy is typically done via intravenous methods and other ways. Monitoring the patient is an important part of the surgery. Pulse oximeter is going to help measure an important vital sign in the oxygen saturation of the blood. It may also look at some heart rate, respiratory rate, temperature with that pulse ox as well. There may be a temperature probe or a respiratory monitor, even an esophageal stethoscope to be able to look at the heartbeat through the endotracheal tube that will be administered when the patient's intubated. Blood pressure might be monitored as well as any electric currents of the heart or echocardiogram. In this case, you see a patient here with a pulse ox and monitor simply clipped to the lip of the patient, and you can even see a IV catheter placement in the right front paw as well. The local veterinary clinic uses a machine, as you can see here, to monitor a patient during surgery. On the right-hand side of the screen, you can see the anesthetic machine that we're going to talk about here shortly. This is a picture of an endotracheal type approach for a stethoscope to monitor heart rate. Here's an example of a patient monitor that you might see in a surgical suite. The anesthesia machine, as we just looked at earlier, picture of that. Its job is to convert liquid anesthesia, the medication, into a gaseous form. It vaporizes that, applies it to the patient. Oxygen is also applied to the patient as well, oxygen flow and monitored. There's a pressure valve, flow meter, and a rebreathing machine. One of the things that the machine also does is to help absorb any carbon dioxide that's released from the patient. As the rebreathing machine works, that soda lime canister is responsible for absorbing the carbon dioxide. You'll simply see a color change in that soda lime canister to indicate the using of that and the absorbency of that in removing the carbon dioxide from the patient. Soda lime can be replaced. Monitoring that, it typically moves from a color of white to more of a color of pink as the absorbency of that material is used up. The anesthetic machine also has other important features, as you can see listed here, and we're not going to go into each of those in depth in our discussion today, but those are listed in your course presentation. The local veterinary clinic using an anesthesia machine, as you can see in this photograph here. Notice that the patient's intubated, has a artificial airway provided, and you can see the blue tube here is providing the oxygen and the anesthetic gas to the patient. Anesthetic machines come in many different shapes and sizes. It may vary a little bit in the way that they look from veterinary clinic to veterinary clinic. Those machines are also going to have breathing systems, non-breathing systems, and rebreathing systems, and you need to become familiar with those as a technician in the surgical suite. Putting the patient under, call that anesthetic induction, inducing them or providing them the ability to be under the effects of the drug for the surgical procedure. This could be inhaled or injected, and the patient will go into different phases or planes of induction. We're going to talk about those in a second. I've mentioned that if the patient is intubated, we provide an artificial breathing tube down the trachea to be able to administer this gas and oxygen to the patient as well. As the patient's being put under anesthesia, we'll monitor the blink reflex to look and see what plane or phase of anesthesia the patient is in. Those planes are listed 1 through 4, with 1 being induction, 2 being a plane where the patient may be somewhat excited and some vocalization and movements present. In plane 3, the patient is under the effects of light anesthesia. The vital signs are normal, the pupils regular in size, and there's mild to no reflexes present. In plane 4 would be in a situation of overdose or a deep plane of anesthesia, and may result in a decrease in vital signs and other processes of the body. Surgical positioning prior to surgery, this is typically done. In most cases, animals are in dorsal recumbency, but this depends on the procedure and the need based off of what the patient is having surgery for. The height of the table can be adjusted, and even lights overhead adjusted to be able to give good light for the procedure. In this situation, Aaron Rodgers, as we've mentioned earlier, has been intubated, restrained to the table, is in dorsal recumbency in this photograph. Post-anesthetic care, when the animal has finished the procedure, or the veterinarian's finished the procedure, and the animal's coming out of anesthesia, taken off the anesthesia machine, maybe moved to a recovery area and monitored to determine when they can be extubated or the endotracheal tube removed. They typically look at the swallowing reflex to help determine that. Heart rate, respiratory rates monitored, and the animal in post-anesthetic care as they're coming out of the effects of the anesthesia may even move around a little bit. They're going to continue to monitor the vital signs until the patient is bright, alert, and responsive from the anesthesia. Post-operative care. Once the procedure is finished, once the animal is out of recovery, possibly at the point that the animal is then returned back to the owner to be taken home, it's important to monitor the pain, infection, any bleeding that might take place after the surgery. Pain needs to be managed based off of the restlessness or the whining vocalization. Those are indicators of a level of pain. It may need to be managed based off of the situation at hand. Most patients may be even withheld food a little bit longer, 12 hours for some monogastric patients. Large animals that are ruminant animals may need to be given food a little bit quicker to be able to get the rumen back working, small amounts of food and water, so that the rumen does not completely slow down. So it depends upon the animal's digestive system on the reintroducing of food and water. Surgery may have absorbable sutures, or sutures may need to be